Types of female pelvis. Let's look at the types of female pelvis in gynecology. So first we have gynecoid pelvis, which is most common female type pelvis type, and then we have android pelvis, which is in heart shape and they have like prominent ischial spines. And then we have arthropoid pelvis, where there is anterior and posterior sides are longer. And then we have platyploid pelvis, they are flat bowl like, but they have longer transverse sides. And now for fetal positioning, means how the baby is positioned when they are passed through the birth canal. So according to the naming, for example, if there is ROP, if the baby is in ROP position, that means the baby is in right occiput, which is baby's back of the head, and P means posteriorly. So the baby is in the right side and the occiput is posteriorly positioned. So the fetal positioning in different types of pelvis. So first we have the gynecoid pelvis. The fetal positioning in this is mostly LOT, which is left occiput transverse, or left occiput anterior, which is mostly seen in normal delivery, and it is an ideal good fetal positioning. And then we have android. In this, there might be a chance of deep transverse arrest, which means the baby's head gets stuck in it, in that area or before ischial spine. And then we might have to do C-section in this case. Yeah. And then we have arthropoid pelvis, in which is direct OP, occiput posterior or occiput anterior positioning without rotating. So because they have a longer AOP and shorter the transverse sides, so the baby's head is, when the baby is passing through the birth canal, they have difficulty in rotating their head. So now we have platyploid, which is transversely oval pelvis, because their transverse sides are longer. So there is asynctalism in platyploid pelvis. So what does this mean? So normally, because there is a longer space in the platyploid pelvis, the baby's head can be rotated. The baby can rotate their head easily, so they might tilt their head, which is called asynctalism. Usually, normally, the baby's sagittal suture is in straight line to the birth canal, which is normal. And in asynctalism, there could be anterior tilting or posterior tilting. Anterior tilting means the parietal bones anteriorly comes first, and posterior tilting means the parietal bone of the baby posteriorly comes out first.